Psychiatry is assault upon the typically abused to transfer suffering into an arbitrary or senseless image of social placidity by destroying capacity to function wholly, narrowing pain into a psychiatric survival course, and thus denying the reality of the target. Psychiatry is an arbitrary set of criteria to transfer absolute power to torturers by any line of false reasoning necessary. Once someone or some group has flagged the condemned behavior or opinion, this is all done in the name of compassion or whoever's safety. It is evil. Psychiatry is torture in which jail, threats and poisoning are used whilst demanding conformity to arbitrary behavioral criteria, and thus those already suffering are denied not only a voice nor respectful discussion, much less are they related to with compassion, but they are denied whole functioning. That this attack upon functioning occurs contemporary to demanding conformity to arbitrary behavioral criteria and false notions no less, lest other drugs and or increased doses of emphatic poisons are recommended and or enforced, while psychiatrists regularly pathologize anyone faster than their slow spirits or those merely depressed or not pleased with the false notions and attempted murder of psychiatric personnel has carved in stone for the ages. Psychiatry is evil. It is as much as the rule that the context of the patient's suffering is ignored, but criteria is matched to symptoms or supposed symptoms, and this then typically leads, in the name of managing risk, to incarceration and to poisoning, with the expectation you will get better or things will get worse for you, you at least will not be released. If you complain about the environment of the asylum, it's your problem. If people are abusive to you, personnel and or patients, it's your problem. You should show insight. You should show compassion. If you do not agree with the false notions of psychiatry, you're said to be deluded. So you are called deluded and stripped of your rights and indeed your integral functioning for not believing in the delusions of psychiatric personnel. It is a taking of the very typically abused and jailing, threatening and poisoning them, as I said, whilst demanding conformity to arbitrary behavioural criteria and to false opinions. In order to produce the false statistics of improvement by